husband's room, I came upon a quiet, compassionate sounding voice speaking to my husband. This nurse that I know now as AJ was unaware that I was standing in the doorway behind him. He was giving his best effort and so reassuring as he was making my husband comfortable. Putting his robe on, changing his pad, adjusting his bed, assisting him with everything he needed, all while being so kind. He took my breath away with his tenderness. He then noticed my presence and continued on being as wonderful. He told me to let him know immediately if my husband was in any distress or pain. He would be there right away, as he was. During my visit that evening, AJ came in multiple times to check on him, to complete his work, always with a kind word. He is the true definition of what it is to be a nurse. He loves what he does. Dedication, compassion, kindness, a true leader. I was able to leave that evening knowing my husband was in the best hands that you could ever ask for. I will never forget him. Jefferson Torresdale should feel privileged to have him as a part of their team. Thank you, AJ, for truly being there. You are this month's Daisy winner. Were you surprised?
Very, very surprised, yeah.
So for those, for the sake of those on the video, AJ actually had left for his shift for the day, and his charge nurse Ange called him back so we could give him this award. So it was a little bit of a tumultuous at the beginning, but what surprised you about it?
I never expect anything. I just do my job. Yeah. I love it. So.
Well, from the sounds of the story, you should expect it. It sounds like you are somebody who probably could win this award every day. Can you tell us a little bit about how long have you been here on 3B as a nurse?
I've been a nurse here for 6 years.
For 6 years? Have you always worked on 3B?
Always 3B, yes.
Yeah. And what is it that keeps you here on 3B?
I love the atmosphere. I love the people I work with.
Yeah.
I love the patients I care for. Being a med surg in college, we usually see a lot of the same patients. Mm-hmm. So when we see them, it's more being able to take care of them again, just do our best to care for them and all.
And you get to know them probably a little differently.
Yeah.
This patient talked a lot about you and the attributes you have that made you special to them. They talked about your kindness and your compassion and just your tenderness, I think was one of the words they used. What do you think it is about you that allows patients to experience you that way?
Well, I try to treat every patient as if they're my own family member. If they're my grandmother, my grandfather, I feel as though if you treat people with respect and care instead of coming in and just trying to do your job, at least, it helps them heal better. And if, unfortunately, it helps the family heal better too.
Well, clearly, this gentleman's wife really spoke about you in a way where she talked about how she felt comfortable going home. And I think that's one of the things we hear the most, that when people actually feel like they can go home and leave their loved one here, it's usually because of people like you. And she described that, I think, really, really eloquently in her letter about you. How do you ensure that happens? How do you instill that kind of confidence in a wife to leave her sick husband here during COVID, with someone that she doesn't know you necessarily as a person?
I really just do my best. I go in with a smiling face and treat everybody with kindness. I mean, it's the best thing, is just being there for them, being calm and happy. Sometimes it's not easy, but you got to know that these people are sick and they need help, and they're not here because they want to be here. They're here to get better, and that's what we're here for. We're nurses. We're kind, caring, and loving. That's what our job is.
Well said. Really well said. Can you tell us a little bit, how's this past year been for you?
It's been to me. It's been fine. I signed up to be a nurse to care for people, so it was rough in the beginning, just wearing all the gear and all. I wear a PAPR, so I'm hooded the whole time, but at the same time I know I was doing something good for everybody.
How did you get through it? So on days, because it was hard,
Well, I think it helped. My wife's a nurse, so it helps, just being able to go home and talk to somebody, it was a hot day, rough day, but knowing that we're doing the best we can for people is the best thing.
And having someone who can relate to what you do.
Exactly.
Because that's hard, you know,
Mm.
for many people who go home and their families don't quite get it. It sounds like you and your wife have that in common, so
Yeah.
that probably helped you a lot. So tell us a little bit about you as a nurse. So you've been here for 6 years?
Yes. I've been here for 6 years. I was a prison nurse prior to coming here, and I was there for a few years, and I did graduate nursing there also.
Okay.
And I left there realizing that I wanted to do more with my nursing and care for people in a different way. There, I feel like I felt as though I was just giving meds
Okay.
and going through the whole line instead of actually having that like bedside one-to-one care.
Well, it sounds like you are much more well suited for that because you're clearly incredibly good at that.
Yeah.
What do you think prepared you to be the kind of nurse you are?
Honestly, I took care of my grandparents, like just seeing them and wanting to know that somebody there is caring for them. So I think that right there kind of made me want to do better and want to be something that would care for people, and I know that people are actually getting true care.
It sounds like, you know, everybody who's in your care is getting amazing care. So
I try my best.
Well, you succeed. Clearly, I have no doubt every night you're here. So, you know, on behalf of all of us and myself, just thank you. Thank you for everything you've done this last year, everything you've done these past 6 years, and I'm sure will continue to do for many, many years in the future. We really appreciate you, and you know, keep up the good work, EJ. Thank you.
I will. Thank you.